Watch this.
We are being absolutely crushed by COVID.
And I am scared. I'm scared for all of us.
Well, we broke through the breaking point for healthcare in the state of Idaho. Hospital officials are now laying out what comes next, and the outlook isn't promising. And what about those not necessarily in crisis at this moment, but are this close? The supporting cast will almost certainly be impacted as well, and could be needing support of their own.
If we have to execute crisis standards, then it's a demonstration of the failure of the community and our leaders to step in and basically turn this situation around.
That was Dr. Stephen Nemerson of St. Alphonsus, the chief clinical officer. That was back in October of 2020, when the state of Idaho was, well, right in the middle, at the time, its strongest surge of COVID-19. Back then, we were told, as you heard, we were nearing crisis standards of care at Idaho hospitals. And if we broke through that, well, it'd be considered a failure. We came close. We didn't hit it back then. Today, we did. Nearly a year later, and in the middle of an even stronger surge of COVID-19. Last night, St. Luke's Health System, the largest in the state, requested the state activate crisis standards. They say they've run out of beds statewide, that they will be treating patients on stretchers until additional beds arrive. And according to their forecasts, St. Luke's told us that every single bed could be occupied by a COVID patient within the next 2 weeks.
We will consume every single bed and every single resource we have with COVID patients in our hospital. Our ICUs are not only full, they're overflowing. The vast majority of our patients in our intensive care units are COVID positive. 98% of them are unvaccinated.
And that's just for St. Luke's. It does not include any of the other hospitals in the state. So the crisis standards have been declared for statewide, but not every hospital is in this mode. So let's take a step back. What does crisis standards actually mean? Well, here's a look at how hospitals operate. There are 3 standards of care. On the far right is conventional. That's how hospitals work in normal times, normal amounts of staff, beds, open, all that kind of stuff. Then there's the contingency mode, which is what our hospitals had been operating under and have been, several of them, for some time. That means, yeah, more staff. They're going to repurpose some other areas of the hospital to make room for patients. And typically, they're still giving the same level of care to the patients. But then there's the crisis standards, which is what we're in now. It means there are not enough beds, not enough staff to treat every single patient that needs care, COVID or otherwise. It means hospital staff are going to now institute a ranking system, decide who does get the care and when. You see how those are ranked right there on your screen. It goes from red, yellow, green, and black would be expectant, which means you're unexpected to live. As of Monday, we hit an all-time high of people in the hospital with COVID. That'd be 678. That's on the low end of the count, as 5 hospitals did not even report their numbers. 173 of those patients, by the way, are in the ICU. We now join the Idaho Panhandle, which has been operating under crisis standards since September 7th. And here's what they've seen there. Kootenai County and Coeur d'Alene has transformed what is supposed to be a learning classroom. They've also added more oxygen tanks there, but they've taken a classroom and turned it into a 22-bed COVID overflow room for where they can take care of patients. You can see, yes, more oxygen tanks being installed there as well. That was a couple weeks ago. Joe Paris, you were with this, or you were watching that announcement this morning, this afternoon, I should say, at 1:30, when the Idaho Hospital Association gathered a bunch of representatives from area hospitals across the state to explain kind of what this is. Now, staffing has been something that, well, is a major concern. One of the reasons that we're in this crisis standard.
Right, and when we talk about how many people that are out of the health system today because of COVID-related problems, St. Luke's tells us that they had 400 people out just today, just at St. Luke's, because of COVID-related issues. 400 just at St. Luke's. Now, St. Luke's tells us, Brian, that they've hired 802 people over the last 60 days, and that includes 450 clinical providers. We heard earlier from Sandy Gerke. She's the St. Luke's Vice President of System Operations, and she explained kind of the scope of the hiring process and how many people they're bringing on just to make ends meet. We'll take what we're in now compared to what we saw pre-COVID.
The influx of healthy hands that we have within the health system. And we have 1,500 more than we had going into the summer. Those are a mix between clinical travelers that we were already looking to secure, that we needed to escalate quicker as a result of the volumes increasing. We have 400 clinical travelers in our health system today. In a typical summer, that would be less than 30.
Less than 30.
So they have more people now going into this surge than they did last summer before we were in it. Yet a lot of people are still claiming, well, it's because of these vaccine mandates that they lost a lot of their employees.
Yeah, and we can just cut that off right now. We heard earlier from our hospital leaders. This is not because of vaccine mandates at select hospitals in the state of Idaho. Just untrue.
But that's all part of this misinformation that we've been hearing
about.
It is,
and misinformation is something that hospital leaders brought up throughout the press conference. And it's a major force, if not the major force, of what's driving the actual problem right now. Of course, the Delta variant of the virus is so contagious, it's moving around so much. But we heard so much frustration from people like Dr. Jim Souza. He's the chief physician executive at St. Luke's. He says that it's frustrating to hear lies from people, not just in the community, but from leaders in the community. And we also talked to Dr. David Pate, the retired CEO at St. Luke's. And when they talk about misinformation, this isn't just random people that are posting on social media. They say they're frustrated with the people creating the misinformation, the people that we're supposed to trust. Here's what they have to say on the battle against misinformation.
It's people who share the credentials that Dr. Nemerson and I do, maybe dress up with a white coat and take a piece of information and then create a big, long line of causation and factoid information around it. And it plays to people's confirmation bias. And that confirmation bias is that we're all tired of this. We all want it to be gone. But just because someone says it's not important and it's not a big deal and nothing bad is going on, doesn't mean that any of that is true.
The misinformation is huge. And that is why I was outraged that the second highest official in our state, the lieutenant governor, while you heard what these hospitals have been dealing with, what is she doing? She's holding a conference to spread misinformation and disinformation. Absolutely just inexcusable, and God have mercy on these people's souls.
And some really strong words there from Dr. Pate. And we've covered some big moments over the last year and a half, Brian. Today is arguably the biggest.
Well, it's because we've pushed this to the extreme at this point. Today is the day that we've gone as far as we thought we'd ever be.
Yeah. In terms of what can we do, frankly, there's not a lot we can do in the immediate right now. They encourage people to do the right things, mask up, get vaccinated. If you have questions about vaccines, ask your doctor. But we heard strong words from Dr. Pate, and he has more strong words. Here's his call on the community to really help fix the situation we're in right now.
Our hospitals are in crisis. It's going to get worse. Please, for 1 month, I'm asking you, give me 4 weeks. 6 if you're generous. Just be careful. Don't do dangerous things. Avoid large groups. If you're going to be out with other people and you don't know if they're vaccinated, wear your mask. Schools, for the love of God, please have everybody wear masks. It's not the kids that are ending up in the hospital so much, it's they're infecting their parents and they're in it. Please wear masks. And for anybody else, if you're hesitant about getting vaccinated and you have a question, ask somebody. Let's get your questions answered. Let's get you vaccinated tomorrow.
And I just real quickly want to touch on how I've seen so many comments that are trying to politicize what happened today. Let's just cut right through this. This is not a political thing. This crisis standards of care is not being declared to make a point, to say we're going to make people feel bad. We're in crisis standards of care because that's where the hospital system is. This isn't something that, oh, let's just do this. No. This was made with careful consideration, and now there are going to be grave consequences because of the situation we're in.
And these healthcare leaders were asked directly for events, like, for example, Boise State football. Is it a good idea to be holding something like that with 30,000 plus in a facility, even though it's outdoors, but packed in and not a whole lot of them wearing masks? They were asked that directly, and they said, Dr. Nemerson from St. Al said, it's not a good idea.
So that's what the health experts are saying. We'll see how things like major events at Boise State respond in the coming days.
And we don't know when this is going to end. So.
Right, yeah, this could go on for weeks. This could go on for months. Unfortunately, our experts are telling us they haven't seen a peak yet. It continues to go up. So we'll have to keep our eye on it.
All right, thanks, Joe. Well, another domino in all of this is how much of a burden has been placed on paramedics, the other frontline workers. What does crisis standards of care mean for those tasked with taking us to a doctor in an emergency? Ada County paramedics told us today they are busier than ever before right now. Now, sure, some of that has to do with our increasing population, but some of that is also related to the coronavirus. How busy has it been lately? We're told, on average, Ada County paramedics transport about 70% of the people they help. Before last May, they've never had 3,000 calls in a month, they told us. Since May, they've had more than 3,000 calls every month. And we're told when it's bad, well, they've dealt with 12 to 16 COVID patients a day. But the good news, as of now, they are not expecting crisis standards of care to have an immediate impact on how they can help people.
About the only change that we've seen, in the last few weeks is one of the hospitals might not be as able to take patients in the ER, but really not a lot has changed for us in the field for paramedics. Some things that we may do differently in the future would be things like, navigating a patient to a more appropriate level of care as opposed to everybody going to the ER, but we're not quite there yet.
So navigating a patient means where they take them. And in normal times, they take patients to a hospital of preference. Unless it's a critical emergency, then they go to the closest hospital. But if conditions get worse, paramedics tell us they might have to decide if that patient would be better served going to an urgent care or their own doctor's office instead of an emergency room. And this, of course, is going to put an extra burden on paramedics who are already getting geared up in full PPE for every call they go out on because, well, they don't know the COVID status of the patient. And they're also under the same stresses, some of the same stresses that is, as other healthcare workers. And they've been under them for the last 18 months. Busier than ever means working extra hours, and now you add those layers of crisis standards where they may not be able to take someone to the nearest hospital because that hospital can't help them. Now, a more immediate impact will be felt by those tasked with picking up the slack. While this is a statewide situation, we heard this afternoon from Eastern Idaho and South Central Idaho hospitals as well. The CEO of Minidoka Memorial Hospital in Rupert telling us helicopters landing at his hospital to bring in patients, it doesn't happen, like ever. It's usually the other way around. But because of COVID, that's exactly what is happening, leading them to turn their surgical area into a COVID treatment area. And they only have one ICU bed there. Portneuf Medical Center in Pocatello, right now in contingency care, but if the current trend continues, they could be in crisis care mode as well, soon. But this crisis mode doesn't just affect the hospitals who request it. It has a ripple effect. If a hospital is in crisis care standards, you would think someone who is sick might have a better chance of being seen sooner, maybe at a primary care clinic instead of a hospital emergency room. Well, don't bet on that either. In fact, that's already a difficult assumption to make. Primary Health has clinics across the Treasure Valley, 600 employees, 99% of them vaccinated or with an exemption. And they still have 30 to 40 people out sick because of COVID each day. Either they have it or a family member does. CEO Dr. the CEO, I should say, of Primary Health, Dr. David Peterman, he tells us their resources are already pushed to the brink and have been for a while. And with this declaration today, he only expects them to get worse.
And we're already gearing up as of today to be ready to take patients that need early discharge from the hospital. They'll be sicker and they'll need their family doctors and their internists to take care of them. And so we're prepared to do our part.
When you say early discharge, explain what that means.
Well, typically we all understand when we have a surgery, or for that matter, for example, we say we have pneumonia, or in this case, if I have COVID, sometimes we would say, well, let's keep you an extra day, make sure you're doing okay. You can't do that now. This is what happens with crisis of standards of care. You have to prioritize, and it's incredibly disheartening, very disheartening.
So the big domino has fallen with the major hospitals under this crisis standards. How does that affect a primary health facility?
Yes, so at primary health, it means the demand is going to continue to go up for our services. Second, they may be sicker and likely are sicker, and we have to be prepared for that. And the third part of this, our family doctors have to be ready for those many patients who might normally stay in the hospital another 2 days, another 3 days. They have to be prepared that they'll be discharged, and we have to monitor their care in the outpatient.
I know when we were this close, when we were close the first time to crisis standards back in December.
Yes.
It was said that if we reached crisis standards of care, we failed. Is that still the mentality?
Well, as a physician and part of a medical group that sees thousands and thousands of patients, if we can't see the patients, yes, that's a failure. We pride ourselves in being accessible. That's the whole point of primary care, that you can call us, you can text us, you can email us. We can see you in our clinics. You don't need an appointment. Today, when you go from 40,000 phone calls a month to 80,000, we can't answer every phone call. And we're having to close our clinics early. We are closing our clinics early at 7 simply because it takes the staff and the doctors from 7 to 11 to catch up so that they'll be ready for tomorrow. It's not like me to say I can't see you. As a pediatrician my whole life, someone comes to me, oh, so-and-so's here, can you see him? Yes, I have to see them, that's what I do. And we are daily turning people away, and it saddens me. I took an oath. Do no harm, take care of the patient. I'm closing the doors open, and I cannot guarantee you we can answer the phone. It's upsetting.
Dr. Peterman made a huge exception to speak with us today. Today is Yom Kippur, the holiest day of the year for the Jewish faith. He's supposed to be in services, not at work, but Dr. Peterman believed he has a moral obligation to get this message out. And he explained it to us this way. Yom Kippur is a day of atonement, a day when you're supposed to think about how to be better, how to atone for the sins committed over the past year. Fundamental to all of this, he said, is how we can be better to our family, to our neighbor, to those we don't even know. He said it saddens him that too many in our community, those that are eligible, have yet to get vaccinated or even wear masks indoors or in crowds. He's frustrated that many of us can't think beyond ourselves. He said, as you heard him say, he took an oath to do no harm, to take care of patients. And right now, yeah, he is saddened that he can't even guarantee that he can answer the phone.
Some nice pictures on Idaho Weather Watchers. And to show you too, Payette Lake up here around McCall looks pretty nice. Now I was mentioning just in the last show, the elevation up there is just a little over 5,000 feet. It's a little under 6,000 feet for the Sun Valley area. And it's a possibility of 6,500 to 7,000 feet Sunday. Above that there could be some snow. So we're talking about that again, the chance of some snow that could be coming around in the area. Main thing for tomorrow and the same thing for Saturday. It's going to be kind of breezy, especially in the afternoon. Winds could be up to 20, 25 miles an hour. And yes, that could be kind of breezy even for the Bronco game. If you look at the satellite radar, it's pretty much clear at this particular point. But if you note the forecast, we're talking about it being pretty warm for tomorrow and Saturday. Saturday could be near 90 degrees. As this storm pushes in, the heat comes up from the southwest. As it pulls through, we drop down to 63 degrees on Sunday. Yeah, and there's quite a bit of storminess there. So there's some showers for Sunday, maybe even into early Monday. So as you look at this forecast, there's your 88, there's the 89 Saturday, 63 Sunday. And when you see that kind of drop in temperature, you could be getting some pretty gusty winds along through there with some of the showers. Monday morning, some spots to the Magic Valley could be into the 30s. So what we're looking at is the possibility of maybe even a little bit of frost in some spots. And then fall begins next Wednesday. Keep that in mind. It looks great.
We like to share some of your photos from time to time here on the 208. We've already done a little bit of that today. It helps us though, especially on days like today when everything seems to be dominated by COVID. We saw that earlier. Again, Facebook's page, or our Weather Watchers Facebook page, we saw some pictures earlier and thought would be a perfect reminder of what we do need to show during times like these. It's love, spelled out in pine cones from the Boise National Forest. Ross, our boss, sent us this picture from the Middle Fork of the Payette River. Just a simple reminder, yes, to take a moment, enjoy the moment, find the peace and love that you can in your day-to-day business. It's been a difficult day for a lot of people, and it's not really going to get any easier anytime, well, immediately soon. It's going to be a difficult period for some time, especially for our healthcare workers. It's also a good time to remind everyone to remember to show each other some love, some compassion, that we do have, well, a simple thing that we can do to share that. Send us your messages of encouragement for our healthcare workers, a simple thanks or maybe a shout out to a doctor or nurse in your life. Maybe you don't know them, but you've seen them at work doing all they can. text those messages to us. You can email them to us. You can reach out to us on any of these platforms that you see on your screen. We're going to share them as they come in probably tomorrow. We'll get to as many as we can, but send them in to us. Final minute of the show. We get texts like this quite often during the 208 from Mark in Mountain Home. Unvaccinated patients clogging the hospital should stick to their principles and stay home. Well, Mark, that's not how this works. As you heard Dr. Peterman say, they took an oath to help people and do the best they can and help patients, and that's kind of how that falls in that regard. So everybody that comes to the hospital needs help, they're going to get it. And don't not go to the hospital is the message we got today. Just because we're in crisis standards of care does not mean you don't go to the hospital if you are in an emergency. Thank God for Dr. Pate and others like him. Hopefully their message begins to help, says Dale in Boise. Dr. Peterman speaks the truth. It's hard for me to see a seasoned professional that helped family members over the years have to struggle for words. It is a hard time for all. If Idaho's in crisis situation because of COVID, can we get help from other states? Well, that was brought up today too. Turns out Utah and our surrounding states also in a similar situation. We've done all we can.